Express. Good day, and thank you for joining us for this important briefing. I'm here to give an update on our state of preparedness concerning the current outbreak of cholera affecting some parts of our country. Cholera is an acute diarrheal illness caused by the ingestion of contaminated food or water that has been contaminated with the bacterium Vibrio cholerae. It is a severe and rapidly progressing disease that can lead to a significant dehydration and even death if not treated promptly. It is transmitted fecal-orally through contaminated drinks, food, or direct contact with infected feces, and easily propagated in circumstances of poor environmental sanitation and personal hygiene. Cholera remains a major public health concern, particularly in sub-Saharan Africa. Nigeria and indeed Rivers State have not been spared from sporadic cases of especially short-lived rural outbreaks. Regarding the past 4 weeks in the state, we have had about 16 suspected cases of acute watery diarrhea across 3 communities in coastal areas of Andoni local government area, with 2 associated deaths. The scenario was rapidly resolved and 2 samples tested positive for cholera by a screening tool with a rapid diagnostic test kit, not confirmed by culture. So far, there are currently no active cases or any outbreak of cholera or acute watery diarrhea in Rivers State. However, using seasonal outbreak modeling, we have pre-positioned commodities around historical hotspots, built capacity of health personnel, and commenced community health education for safe hygienic practices. The state surveillance is at an all-high for triggers and suspected cases. The Infectious Disease Treatment Center at the Rivers State University Teaching Hospital, which is marked for upgrade to an infectious disease institute, is ready and able to manage cases in the case of any eventuality. Let me assure you of the state government's commitment to adequately support, respond, and contain these priority diseases, working in partnership with World Health Organization, National Center for Disease Control, other sister ministries, agencies, and stakeholders. We will remain resolute and proactive to ensure health security for residents of Rivers State without panic or stigma. It is important to remind you that cholera is preventable. Residents are therefore advised to ensure safety of drinking water, practice good hygiene, regular hand washing with soap and clean water before eating, preparing food, and after using the toilet. Use of alcohol-based hand sanitizers is also recommended. Keep fingernails short and clean to prevent bacterial buildup. Prepare and consume food safely. Cook food thoroughly and consume it while warm. Wash fruits and vegetables with clean water before consumption. Keep food covered to protect it from contamination. Stop open defecation and ensure toilets are properly cleaned and maintained and are at a safe distance from water sources. Refrain from bathing, wading, or swimming in potentially contaminated water bodies. In conclusion, I urge us all to follow these advisories and be good advocates for health. Whenever ill, seek medical help at the nearest health facility. Do not create panic or spread misinformation. Our collective efforts is crucial in ensuring the safety of our communities. We will continue to provide updates on our progress and any new developments. Thank you for your attention and your cooperation. I am Dr. Adeze Chidinma Ure, the Honorable Commissioner for Health in Rivers State.